Hello, everybody. Welcome to our first May month's webinar called Beyond the Audiogram. Today, we will be talking about auditory neuropathy spectrum disorder and auditory processing disorder. So, welcome. And now let me introduce our speaker today. Our speaker is Bernadine Kiley. She is a graduate of Dalhousie University, and she started her career as a pediatric audiologist at Janeway Children's Hospital. And for the last 24 years, Bernadine has worked as educational audiologist in the K-12 public school system here in Newfoundland. Her areas of interest include hearing assistive technology, both in and out of the classroom, as well as auditory processing disorder. So, welcome, Bernadine, and
Thank you so much.
you can take over now.
Okay, great. Thank you, Marta, for the very warm welcome. As Marta said, we're here to chat about auditory neuropathy spectrum disorder and auditory processing disorder. Many of you maybe have had the experience, uh, or people experience hearing loss. They struggle to hear if there's any kind of noise in the background, or sometimes even if in a quiet setting, perhaps you mishear or may not understand what's being said. So eventually you want to check this out. So you would go to perhaps a hearing screening sponsored by an organization like the Canadian Hard of Hearing Association, or perhaps you make an appointment to see an audiologist. You want to get your hearing checked because you're having these struggles. So you put the earphones in and you listen for the tones, and at the end of the session, you're told that your audiogram shows normal hearing and they didn't find any hearing loss. So this is obviously very confusing to you because you were struggling with this and you know there's something there. So that's why this presentation, when we're looking at these type of hearing losses, they're beyond the reach of the audiogram. So we will explore those today and hopefully give you guys some answers. So I will start with a short video. It's about 2.5 minutes, just to show how the hearing system works.
Have you ever wondered how sounds make their way from the source all the way to your brain? Take a trumpet, for instance. When it's played, it makes sound waves in the air. The outer ear catches the waves, which then travel through a narrow passageway called the ear canal. The sound waves reach the eardrum, which is a membrane roughly half the size of a dime. They make the eardrum vibrate, which in turn vibrates 3 tiny bones called the malleus, incus, and stapes. These bones amplify or increase the sound vibrations and send them to the cochlea. The cochlea is shaped like a snail and is the size of a garden pea. It is filled with fluid, and the sound vibrations make this fluid ripple, which creates waves. Hair-like structures called stereocilia sit on top of hair cells and are grouped together as hair cell bundles inside the cochlea. The hair cells inside the cochlea ride these waves, and the hair bundles are moved. The hair bundle on top of the hair cell turns these movements into electrical signals. As the hair bundles are moved, ions rush into the top of the hair cells, causing the release of chemicals at the bottom of the hair cells. The chemicals bind to the auditory nerve cells and create an electrical signal, which travels along the auditory nerve to the brain. Different hair cells respond to different frequencies of sound. The hair cells at the base of the cochlea detect higher-pitched sounds, such as a piccolo or flute. The hair cells toward the top of the spiral detect progressively lower-pitched sounds, such as a trumpet or trombone. At the very top or apex of the spiral, the hair cells detect the lowest-pitched sounds, such as a tuba. The auditory nerve carries the electrical signal to the brain, which interprets the messages as sounds that we recognize and understand.
So I like that video because it's a nice quick explanation of how hearing happens, and also because it includes the brain as a player on this team, just like this graphic does. A lot of times when you Google search, I want a picture of ear anatomy, it'll just show you like the outer ear, the middle ear, and maybe the cochlea. A lot of times the brain is left off the team, and it's a very, very important player. Um, this quote, "We hear with our brain, the ear is just a doorway." I have this kind of poster in my clinic here at the school where I work. It's just a reminder that the brain is a very important part of listening and hearing and understanding spoken language. So the ear is, like I said, the doorway. And so we just watch the sound travel through that doorway. And if there's a problem at any point in that doorway, the sound, of course, is not going to get through. But it also has to go beyond the cochlea, travel along the auditory nerve, and arrive at the brain for it to be literally heard. Like that's where hearing happens. So hearing screenings and basic assessments, like if you get your hearing checked, you're having some hearing loss difficulties, basically that just looks at the status of the doorway. So can you like detect speech or speech frequencies within normal limits? You sit with under some earphones, you listen for some tones, and you raise your hand or press a button each time you hear one. So they're just seeing how the doorway is operating. So it's not going to give you information about anything happening beyond this doorway. So if there is an issue with the doorway, it will pick that up. This is the audiogram, the report that you would get at the end of a hearing test or hearing screening. And it basically marks on a graph the how loud or how quietly you can hear sounds at various frequencies, the important ones for speech. And so if there's a hearing loss identified with a hearing screening or on an audiogram, then you can, kind of understand why you may be having some struggles. Like this audiogram that's being pictured here, it looks like this individual hears lower frequencies around 20 dB. As we get to the mid frequency, it drops down to 40, and it looks like the person, the tester, is going to be about to mark 2000 hertz around 70 dB. So if we look at the picture next to it, which is called the audiogram of familiar sounds, it's the same graph, and it just has a bunch of pictures on it of things that we are familiar with what they sound like. So, and also some speech sounds. And so if you graphed that hearing loss onto this graph with the pictures and letters, you would see that a threshold of 70 dB out at 2000 hertz, you're going to be missing a lot of stuff in the top right-hand corner of that audiogram. You would miss the sound of leaves rustling, birds chirping, quiet speech sounds like an S, a TH. So if you're missing certain quiet speech sounds, then you're not surprised that you would struggle or mishear or misunderstand what somebody is saying. But the confusion comes in as like I said before, is if you have a normal audiogram, and so you're wondering, well, why then do I struggle if my audiogram is fine? It's because detection is crucial. Like obviously, if you have some hearing loss, you can't detect certain sounds, you're going to struggle. So it's crucial, but it's only step one. So what a lot of people don't realize is that a normal audiogram does not always mean normal auditory function. So the doorway functioning well is crucial, but it's only the first step. It's how sound gets in. That sound has to travel to the brain and be understood. So that retrocochlear distance, what happens beyond the cochlea, beyond the reach of the audiogram, is also very important. So you probably have heard tell of types of hearing loss. Like someone can have a mild loss, a moderate loss. That's the degree of hearing loss they have. But their type of hearing loss is also another descriptor. If you had, say, a lot of wax buildup in your ear canal, if you had a bad head cold and fluid in the middle ear space, sound would not get through that obstruction very well. And so it wouldn't transmit into the cochlea. It'd have to be louder, it'd sound muffled. So that kind of hearing loss would definitely be picked up on the audiogram, on a screening, and it's basically sound can't conduct through the system. There's a problem. That's where this problem lies, either with the wax in the ear or like fluid behind the eardrum. Other types of hearing loss are sensory neural, which is uh, damage in the cochlea or the inner ear. Um, can be caused by a lot of things: hereditary exposure to noise, certain medications, certain cancer drugs are ototoxic. So if someone's undergoing chemotherapy, it can potentially impact their hearing. Uh, and sometimes it's just an unknown reason why someone would have some hearing loss. Uh, but yeah, the hair cells can get damaged by noise, and so over time, the hearing can fade. That will be picked up by the audiogram. It'll show, your detection of sound is not as sharp. Sound has to be made louder for you to detect it. But beyond that is a neural type of loss. If there's a dysfunction of the auditory nerve, because if that sound reaches the cochlea fine, it still has to travel along the auditory nerve, and there can be issues. The problem can lie there. And it also has to reach the brain, the auditory cortex, and the issues could lie there. It need not be a doorway problem at all. And those type of neural hearing losses, like auditory neuropathy, or central hearing loss, like an auditory processing disorder, are what are called retrocochlear and beyond the audiogram. And so this may be where a person's struggle lies. So they find when they go get their hearing screened or a simple hearing test, it's not picked up. So there are certain tests that need to happen beyond just a basic audiogram in order to detect retrocochlear issues. And so I'm just going to chat briefly about a few of these extra tests. One is called otoacoustic emissions, or OAE. Basically, a sound is put into the ear and a response is recorded back. It can take like 20 seconds to do each ear. So it's a very quick check. And it basically is showing the response from the outer hair cells of the cochlea. So it's showing that these are all functioning and working well if we get back a good response. So it's not a test of hearing per se, but it shows that the outer hair cells of the cochlea are healthy and functioning well, which is consistent with normal hearing. So this is something that's used, as you can see, there's a little picture there of a little wee baby, and it's something that's used to screen newborns. Another specialized test you may have heard of is called the auditory brainstem response, or ABR. What this does is tests the otolaryngological integrity. So it's basically tests of the auditory nerve, the brainstem and beyond to the auditory nerve. So perhaps some of you who are participating today may have had this test done. You're wearing some earphones. You don't have to respond or anything. You just sit quietly and relax. Typically, you listen to a clicking noise, and there's some electrodes attached to your skin, and they record the response as that sound leaves the ear and travels along the auditory nerve to arrive at the brainstem. So it's looking at that the roadway between the cochlea and the brain. So what the audiologist is looking for are certain peaks that are labeled with Roman numbers here. So wave 1, wave 2, the 4/5 complex, sometimes as it's called. They're looking for these waves to happen at a specific time after each click. So the whole response of the ABR takes about 6 milliseconds. So it's very, very quick. So sometimes you have to sit there for like 20 or 30 minutes as they, gather, like run sweep after sweep after sweep to get enough averages to see the response, because it's so tiny and so quick. So what they're looking for, like as I said, are these peaks to happen at specific times, and the distances between the peaks to be even, like the inter-peak latencies. They also, of course, this is done in either ear, so they look at the interaural latencies as well, so they have to match. So basically, they're looking to see that as the sound enters your ears and travels along the auditory nerve, is that all in sync? Is it happening smoothly and in sync, and the sounds are arriving at the brain together? So which brings us to the first of the retrocochlear hearing losses, the auditory neuropathy spectrum disorder. This is a retrocochlear hearing loss where sound is not transmitted properly from the cochlea to the brain. So it definitely involves the auditory nerve, which is the roadway between the cochlea and the brain. But it could also involve the inner hair cells of the cochlea and the connection between the two. So a common feature of someone with auditory neuropathy spectrum disorder is a struggle with understanding speech, and it can be highly variable because it is a spectrum disorder. You can have a very mild auditory neuropathy, or you can have a more moderate or even a very severe auditory neuropathy. So the testing right now can just detect, like, yes, you have this, or no, you do not. But it's not yet sophisticated enough to say what degree. It can't tell you if it's mild, moderate, or severe. So basically, your own experience sort of can tell you that. So a very mild neuropathy could have like difficulties understanding speech that only show up if there's some background noise. Otherwise, you're fine. Um, or it could be severe enough that you're fine listening to speech and understanding it in quiet environments is even challenging, right? And the audiogram that you sit for, the doorway check, can show everything from normal hearing to a profound hearing loss. Because the cochlea is still involved here, they're inner hair cells of the cochlea. So there can be changes in the audiogram, but you can have a perfectly normal audiogram and still have an auditory neuropathy spectrum disorder. So what causes this? Demyelination is one of the major causes. Think of myelin as sort of the shield over the wires that are the nerves. So if this myelin is degraded in any way, then the signal traveling along the nerve can leak out during like breaks in this myelin. So if some of that signal is lost. So when one nerve passes it to the next nerve cell, which passes it to the next nerve cell along the road, and the next one, and the next one, the signal can be lost along the way. So what, like the pristine good signal that left the cochlea, by the time it arrives at the brain, could be quite distorted because of all the lost bits of information along the way. Sometimes premature birth is a cause of this, hereditary, viral infections, certain stroke, of course, ototoxic drugs, drugs that are hostile to the ears, certain metabolic disorders like multiple sclerosis, and neurological disorders like there's a couple there: Friedreich's ataxia, Charcot-Marie-Tooth syndrome. Basically, anything that attacks the nerves can cause demyelation and interfere with not just how auditory signals pass to the brain, but a lot of other signals, like these other uh, metabolic disorders and neurological disorders impact the muscles and everything like that. So all kinds of signals traveling to the brain are impacted. It could also be inner hair cell damage. Again, ototoxic drugs can cause this, or enough noise exposure, or heredity. So how do we diagnose this? The hallmark diagnosis is an absent ABR with a normal OAE. So both ABR and OAE can be used to screen like babies. So we can actually diagnose auditory neuropathy spectrum disorder at birth. In someone who's struggling, it can be diagnosed in an adult as well. An adult can sit for an OAE and an ABR. So there's no response from the auditory nerve. You get no response on the ABR, essentially, except a ringing that's called a cochlear microphonic. So we have some images there. If my voice as I'm speaking now is causing the air to vibrate. If you're tapping your hands against your leg, you're causing the air molecules to vibrate. So that's how sound travels through the air. The air molecules sort of like crush together, come apart, crush together, come apart, and it just moves out through the air. So they're either compressed or what's called rarefaction. They spread apart. So in the same way, when someone's hooked up for an ABR and they put the earphones in, the microphone that sends the click signal, it can, send the click, with compressing the air first, and then it moves compression, rarefaction, compression, rarefaction, compression, rarefaction. Or it can reverse the polarity and sort of the diaphragm of the microphone gets pulled back. So it sends the rarefaction first. So you get rarefaction, compression, rarefaction, compression. it doesn't matter which polarity, you're still getting that movement of the air molecules and sound moving through the ear. So it has no impact on the response from the auditory nerve. What it does impact is the response from the cochlea. So if we're doing, you can see in the picture here, a response of an ABR, you can see wave 1, 3, and 5 labeled with the Roman numbers. So the waves are replicating nicely. So they're matching up here with whether condensation or rarefaction. Whichever way the signal is sent in, the click signal, you're getting a nice response. The picture below, it shows that when you reverse the polarity, the signal also reverses, the response you're getting. So every peak, it's almost like it's a perfect reflection when you reverse the polarity. So this is the very telltale ringing response that screams auditory neuropathy. Someone realizes that that's exactly the pattern that it is. And of course, OAE testing will show a normal response because if you recall, it tests the outer hair cells, and those are fine if someone has auditory neuropathy. The issue is the inner hair cell. So that's the combination that we can use to diagnose this. So if you do have this, there are treatments and available and options. Some people will try amplification, hearing aids, if the audiogram also shows a hearing loss. So that may be that the outer hair cells are also involved. So the hearing aids will improve that. Cochlear implants are an option if the issue is the inner hair cell, because the cochlear implant, it bypasses that damaged inner hair cell and stimulates the auditory nerve directly. So that may just resolve everything and everything is synchronized that way if the problem lies in the inner hair cell. So as I said, we can't really tell the point of problem or the degree of this. So it's a roll of the dice whether this will like totally resolve the neuropathy, or it may not have an impact at all if the problem was further along the auditory nerve. Certainly people with auditory neuropathy spectrum disorder will struggle if there's any kind of background noise. So hearing assistive technology that improves audibility in a noisy listening environment, people find that very, very beneficial. And of course, if the neuropathy is quite severe, that individuals can't even hear or understand, through the distortion, even in very quiet environments, they may need to rely on American Sign Language as opposed to a spoken language as their means of communication. So I'm going to try this little audio simulation that's on this slide. It basically it's a sentence that's read, and it simulates a very severe neuropathy and then a more moderate one, eventually a milder one. And at the end, we'll hear the sentence just clearly and quiet, just to give you an idea of what individuals with auditory neuropathy spectrum disorder may hear when they're listening to speech.
Time present and time past are both contained in time future. Time present and time past are both contained in time future. Time present and time past are both contained in time future.
Yeah, it's interesting and it's very telling. Like if someone has a quite severe neuropathy, of course, hearing aids would not be helpful because you're only amplifying like a very distorted, staticky sound that they still can't, attach much meaning to, or it's not very meaningful. So it's a very individual, the treatment options, whatever's going to work best for the individual. Another thing to know about auditory neuropathy spectrum disorder is it can resolve. Like, while there is no cure, um, the one way it can be resolved, we already mentioned, like if the problem happens to be the inner hair cell, then cochlear implantation can bypass that damaged inner hair cells and resolve the neuropathy. So the individual has no distortion and gets a nice clear signal. Another way that you can cure, sort of, or the neuropathy can resolve, as if the issue was prematurity. So infants born very premature, it's not so much that there's been demyelination of the nerves, it's just that they are so premature that the myelin has not finished forming. So as these children are cared for and they grow and become healthier, the myelin sheathing over their nerves comes in and gets complete, so that as they grow out of infancy, the neuropathy does resolve. So if they're tested as newborns, very premature newborns, they show the classic auditory neuropathy signs. But when they become more full term size and whatnot, you run the same tests, the ABR and the OAE, and you can see the neuropathy resolve, because the myelin had had a chance to finish growing, just like they're little cells, like they're just not finished growing yet when they come prematurely. So those are kind of ways that the neuropathy can resolve. For most people, though, it doesn't really get better. It can remain stable or fluctuate. Like it's very individual. So if you're having some struggle listening, especially in background noise, it'd be worth going, like, say, beyond just a screening or a quick audiogram, and inquire about like OAE testing or ABR testing, which can be done through through an audiologist, and just to see what your results can be, and you can discuss treatment options or a plan with your audiologist at that point. So we have one more hearing loss to talk about. And before I do, I'll mention one other specialized test, the acoustic reflex. So that is essentially a muscle contraction in the middle ear that responds to loud sounds or vocalization to protect the ear. Like as I'm speaking to you now, my middle ear muscles are all contracted to protect my hearing against the sound of my own voice vibrating inside me. So basically it braces the middle ear system, so that when vibration hits it, it doesn't shake as much. Everything is braced, becomes a little stiffer, and to protect the ear. So we can measure it, either put some sound and measurement in the same ear, and that's called an ipsilateral measurement of the reflex. It can also be measured contralateral, where you present the sound to one ear and take the measurement in the opposite ear. So people with normal hearing will typically have a threshold, reflex threshold of 70 to 100 dB. So sound has to be, nice and loud to trigger that reflex. So you can see kind of on the side here an example of like a printout, the 80 dB sound was presented to the ear. You barely get a little ripple. You go up by 5 dB to 85, you get a nice dip, and 90 a very more prominent dip. So you're seeing that reflex present in that 70 to 100 dB window. So that's within normal range. So if the reflexes are elevated, meaning you have to put sound in over 100 dB in order to trigger them, or if they're absent altogether, that's another key determiner for different types of retrocochlear hearing loss. So as I said, the last type of hearing loss is auditory processing disorder. So auditory processing basically is what the brain does with the signal once it arrives there. So the brain is still the most sophisticated computer around. It does a lot of signal processing when that signal comes in from the auditory nerve and arrives at the auditory cortex. This is a list of some of the processing that happens to that signal in order to make meaning, attach meaning to it, and to understand it. So auditory brain development is crucial. So the cortex has to be, ready and formed. The first 6 years of life are a critical window. Birth to 3 is especially critical. It needs stimulation to develop its structure and function. So the more good, clear signal is getting in through the doorway and arriving at the brain, the structure and function of that auditory cortex is being developed. So auditory processing disorder is a disorder of the auditory system that disrupts the way the individual's brain understands what they're hearing. So this results in persistent challenges with any auditory activities. So APD is distinct from and exclusive of non-auditory issues. Things like language delay, autism, spectrum disorder, ADHD, intellectual disability, is distinct from those other disorders, even though they also can cause challenges with the auditory activities. But the cause of those challenges is not primarily auditory. It's the language delay, it's the autism, it's the ADHD. So we're looking at just a disorder of the auditory system. It's not an auditory processing disorder if there's another cause, a non-auditory issue. So the cause of APD, there's still some debate about that. Certainly head trauma, hypoxia at birth, prematurity or can be a cause of that. Hereditary is a factor. Also recurrent ear infections. So if you have a lot of ear infections, some kids will have a huge number of them when they're babies and toddlers, and always be on antibiotic or have a lot of sets of tubes in their ears. You may know, members of your family who had that kind of history. Essentially, when there's ear infection or a lot of fluid in the ears, you want to get it treated as quickly as possible with tubes or with your medicine, your antibiotic, to keep that clear signal coming into the ear, especially in infants and very young children. Because, of course, if you have stretches of time where the signal getting through like a fluid or infection, so it's muffled, you're not getting a clear acoustic signal in to the brain during that critical, especially birth to 3. And so it can impact auditory brain development. So that if a child then is like older in school age, and like they maybe did not had an ear infection in years, like not since they were like in kindergarten, and now they're in grade 4 or 5, but they're struggling in school. And it's because like that history of recurrent ear infections had an impact on their auditory brain development. So now it's tougher for them to process, the signal that now clearly is getting through, but they're having some struggles. Certain areas of the brain did not develop in the same way because of the poor acoustic signal earlier on in their lives. So common symptoms of this APD is difficulty understanding speech in noisy environments. So that's similar to auditory neuropathy spectrum disorder. But typically, like sometimes with auditory neuropathy spectrum disorder, even in quiet, you can struggle to understand. But typically, if you have APD, you're perfectly fine as long as the listening environment is good. It's with there's noise that you struggle. You can have trouble distinguishing similar sounds, misinterpret tone of voice. So you miss things like sarcasm or you don't get jokes. There's can be learning or memory issues, struggling following directions, a poor auditory memory for lists or sequences of things. Kids or even adults can appear inattentive or easily distracted. It can be fatiguing to struggle to listen. So, kids or adults will just, tune out, take a break from it. Sometimes kids are labeled non-compliant because they're not, following directions when really they don't understand or have the ability to follow the directions. And there's also social and emotional impacts. You can avoid social situations because it's so tough to understand, and a lot of them take place in noisy environments. And people can start to feel like less capable because of their struggles, and it can impact their self-esteem. So this was a cool cartoon that a kid who has central auditory processing disorder actually sketched. You speak butterflies, I hear bats. So it's kind of like they're trying to explain how it is for them. So I thought this was a very cool cartoon. So yeah, it's very invisible. Like I said, the audiogram doesn't pick it up, and so kids or individuals who have auditory processing disorders can like struggle for a while. Um, so others around him, like their coach says, like he doesn't listen when he's on the field. The teacher says he has trouble following directions. He needs to focus. His classmates complain it takes forever to answer a question. Like he needs time to process and think through it. It doesn't happen easily for him. Friends say he never gets my jokes. because of course, like, tone of voice and things like that is so important for jokes. Kids can be, with this disorder can find that really a struggle. Like kids often struggle with reading, so like they'll get like special help from or tutoring, and they'll say like he's memorizing words, and you can't just read by trying to memorize words. You have to learn how to decode them. And the parent says like, his homework has become my homework. I'm working hard, and he seems to put in a lot of effort, and we're just trying to keep up. And the pediatrician says he's passed his routine hearing and vision exams. So like, he's had the hearing test, his hearing's fine. And so the child says, I'm trying my best, right? But it can be an invisible disorder. So again, there's specialized testing that has to be done to identify it. So it's a battery of tests, actually, to identify auditory deficits, and it has to be things like attention, motivation, and language delay, and things like that have to be controlled for, so they don't muddy the waters. You're trying to look at just the behavior of the auditory system. So it involves, like I said, a battery of tests, and here's just some of the testing that I would do when I see kids for auditory processing disorder assessments. So the little kid on the side there is going, oh my goodness, that's so much work. And it is tough because I do this testing for kids as young as 5 and right up to like any school age kid. That's the kids, the population that I follow. So for a 5-year-old to sit through some of this stuff, it is tough. So just keeping their motivation high is part of it. So sometimes I almost feel like a cheerleader. So just as long as the little kid is smiling and hanging in there, and they're giving their best effort, and so yeah, that's part of it, just to make sure they're staying motivated. In terms of the focus and attention, that's controlled for or looked at by one of the tests called the ACPT, or Auditory Continuous Performance Test. Essentially, the child has to sit through a list of words. It takes almost 10 minutes of just constant repetition of this list of words that they're listening to, and the words get repeated, so they'll hear the same number of words over and over and over. Their job is to listen for the word dog. That's why we got that cute little puppy right there. Every time they hear the word dog, they just signal with a thumbs up. So it's a very basic test, but it's very telling that kids who have any struggles with focus and attention, they really, really find this one very difficult. They understand the test. They know they have to thumbs up for dogs. But like I said, it runs almost 10 minutes, and it's really tough. Now, as an audiologist, of course, I wouldn't diagnose a focus or attention issue. That's a pediatrician's job. But if kids struggle with the ACPT, it's very telling, and it's just sort of more ammunition that the parents can take, along with testing that's done at school, and go to their pediatrician and say, look, focus and attention seems to be a struggle, and so the pediatrician can take it from there. And there's also the electrophysiologic tests, the ABR that we mentioned earlier, and also acoustic reflexes. There's no like hallmark, like definitive thing like for the auditory neuropathy spectrum disorder, but we still do these tests, and they're still important because they provide insight into the function of the neural pathways and also confirm auditory involvement. So kids or individuals with an auditory processing disorder typically will have a delayed in their response. So as I said, like the audiologist, you're listening to the clicking, and they're expecting these waves that are numbered to happen at specific points, and the interpeak latencies, the distance between the peaks of the waves, to happen, at certain points. And if things are delayed or the latencies are prolonged, that's an abnormal ABR, and that's often present in kids with auditory processing disorder. And elevated contralateral reflex thresholds is noticed. So this is where they put the sound in one ear and take the measurement in the other. So ipsilateral, the sound and the measurement in the same ear, like these kids have normal audiograms, are expecting like normal reflex thresholds between 70 and 100 dB. And so, yes, they are when measured ipsilaterally. But when you measure contralaterally, the thresholds are typically elevated. And that's a finding common with kids with APD, or any individual with APD. So here's a little simulation. We don't need to wear headphones. It's just a short story, and you're going to listen to it as if you had auditory processing disorder. And there'll be some, like I said, a few questions at the end to see if you could answer them.
There was a boy named Jack and a girl named Joe. They were both brother and sister. They were both instructed by their parents to get some milk at the market since they ran out this morning from eating cereal. Jill put on her blue coat as Jack got his hat. Jack was all ready to go, but she had 3 pairs of shoes to wear. Eventually she decided, and off they began their adventure to the market. Along the way, the dog street and the meat runs it. Knowing well that they needed to be home soon before it got too dark out, he left alone. Jack called her and says, "Wow, that's a little." Jill comments, "Yeah, I could just grab." The cloud grab one and eat it. They finally made it to their time for supper, and at the dinner, parents about their small adventure to the market.
So yeah, it's interesting if you were able to answer all questions or indeed any of the questions. So sometimes I know kids in the school system often have listening components, like they have to listen to a recording and then they're asked a series of questions about it as part of a lot of language arts or English courses. And so kids with auditory processing disorder really, really struggle with that because the signal, it's not interpreted well in their brain, and it's not a doorway issue. It's not that it's not loud enough or it's not clear enough. It's not because there's a hearing loss, like in a doorway issue. So there's nothing you can do with the signal. It's just when it reaches the brain, it's not broken down well. So you can imagine the struggle they would have answering questions if they just had a story they listened to or a passage they listened to. So there are treatments for auditory processing disorder. It's usually a 3-point approach. There's deficit-specific auditory training, improving the listening environment, because of course it's difficult to listen, and classrooms are noisy and the world can be noisy. So improving the listening environment is a definite good strategy, and also compensatory strategies. So auditory training, these are programs that are specific to the individual. So if I see a kid and diagnose them with a specific auditory processing deficit, I can choose auditory training to target that specific deficit. And the program, like I said, is very individual. It can involve like pencil and paper tasks, sometimes even physical activities. Singing to music is one such example, or activities that cross the midline, mirror drawing. There's different activities, like physical activities, and also there are computer-based apps. Kids love screens, as you know, and so there's apps that kids can download that can target specific deficits. And so by doing this auditory training, they're retraining their brain so that another area of it takes over the performance of the listening skills they struggle with. So in this way, APD can actually be cured or remediated. So this is came out of like brain plasticity studies, looking at stroke patients. Like if an individual had a stroke, it may impact their speech. They may be unable to move their right arm. It depends on what area of the brain the stroke affected. So with physiotherapy or with speech therapy, with enough repetition, many individuals regain the use of their arm or regain the ability to use spoken language. And so another area of the brain got trained to take over that function from the area that got damaged by the stroke. So if an individual had APD, maybe because they had like a history of ear infections as a infant and toddler, then a certain area of the brain did not develop to perform that function. So that by training, doing the auditory training intensively, they can actually retrain their brain to perform that function well. So it has to be daily, and it's a 6 or 8 week commitment. But once it's done, it's done. Like if it's had its impact and retrained the brain, then I could see that child back and retest, for the auditory processing, any of the tests that in the battery that they struggle with, and you could see them now perform within normal limits. So you can actually remediate the auditory processing disorder. Improving the listening environment, as I said, that's another prong of a strategy. Sometimes this is low gain hearing aids or remote microphones. Or hearing assistive tech, just making it easier to hear. I have on here classroom adjustments. Of course, I work in the school system, but even like an adult, if they're in a noisy area, if you're meeting a group at a coffee shop, maybe you want to sit away from the counter or the entrance and the exits, so it reduce the noise. You may want to sit with your back to the windows so that your communication partner sitting opposite you, their face is in full light, so you can get all kinds of visual cues. So there's ways to improve your chances, and effective communication strategies. So jot something down if it's misunderstood. Make sure you have someone's attention before you speak, or don't just say like what did you say, or you could ask someone, what did you hear? Like find out what was missed exactly. And the compensatory strategies, well, self-advocacy is always very important. So take control of it yourself, and like I said, preferentially seat yourself or near a speaker, ask for clarification for things you miss. Using external aids like calendars and planners to stay organized, verbal rehearsals, things like that to help remember and organize things, and also professional supports. Sometimes, of course, auditory processing disorder can cause secondary things like, of course, speech and language delays, because we learn spoken language through listening. So if that listening is compromised and the auditory cortex is compromised, then of course speech and language progress can be compromised. And as I said, like having this disorder is hard. Kids can like feel very like something is wrong with them, or it's their fault, or it can impact their self-esteem, and they withdraw socially, or they can have very anxious about attending school because they're struggling so much. So they may need other supports like in school, like speech and language professionals, IRTs or whatnot, to take care of like kind of the non-auditory issues that can accompany having the auditory processing disorder. So does it ever get better or worse? As I said, it can actually be cured and resolved completely with when undertaking that correctly, that auditory training to retrain the brain to perform the function of the affected area. So that resolves things. But improving the listening environment and other compensatory strategies may still be beneficial or still be needed for a while, and non-auditory impacts may also persist and require support and management. Like a lot of the kids I see for this testing, they've been struggling in school for a while. So, they're behind on the reading, and they have speech and language delay, and maybe they're getting interventions, and they don't seem to be making progress with the interventions. And so eventually it gets down to a referral to me to see if they have an auditory processing disorder. And so as I say to the parents or the families of the kids I assess, that if we do identify something, I do say like there's auditory training, and if you undertake this, and I've seen a number of kids back and they've remediated the APD, like their scores are now within normal limits. But I explained to the parents that this won't instantly turn them into A students, because of course they've been struggling with reading delays or speech and language delays for a while. So but what it will do is it will help them make progress, because before, all the intervention by other professionals like SLPs and extra help in school, and all the excellent help they were getting, it was like trying to build a house of cards on a waterbed. because that undiagnosed auditory processing disorder was undermining everybody's best efforts, even the child's. So once the auditory processing disorder is remediated, well, now you're building your house of cards on a table, and you have a fighting chance for that to just go and go and go, and the kid to take off with it. Because untreated APD just continues to undermine any and all efforts to improve its symptoms. So unless the auditory training is undertaken, then the APD just is there. So that's I've been chatting with you for almost an hour, so I just want to open it up now if there's any questions or comments or anything.
Thank you, Bernadine. That was very informative, and that is information not easy to come by. In our experience, those topics are not as
widely known about,
widely discussed, and information is not easily available on those conditions. So thank you so much. This will be a valuable resource for us to share in the future as well. So another question is, can you share the names of some apps that you use for the retraining?
Yeah, there's I have a list that I include. It's very dependent on what needs to be addressed. Like auditory patterns light is one that I use, and that's if a child has a prosodic deficit, which means they have a struggle with pattern perception or temporal processing. So that trains that specific deficit. So it's very specific to the child. So when I, like I said, when I draw up a report, like I said, here's our certain apps or here's certain activities, and so you couldn't just take, this really helped my other friends, with APD, so I'll just do the same because your APD could look different.
Yes, so from the presentation, I understand there are different types of apps for different types of processing issues. So
yeah,
it's not one size fits all.
correct.
So it needs to be. So what would be the best approach to make an appointment with an audiologist, or who can
Yeah, it's
assist in
if you're
those things?
suspecting this, like you have as an adult, I don't know if I do know that Blair Stockley with NL Health Services used to do this testing. I don't know if he still does. I don't know if any of the private practice audiologists would do it. If an adult wanted to be tested. I only see kids. I'm still pediatric, so but if someone has like a kid in the school system that they're thinking about or whatnot, um, then have the school make a referral, because the best thing is to have the complete assessment and get a specific diagnosis, and then targeted, tailor-made treatment for what's identified, right? Generic things, like if you just improve, like the compensatory strategies, like improving the listening environment, making sure you have a child's attention, like almost treating the child as if they had a hearing loss, like a more typical hearing loss, is always eliminating distractions. Like all that's going to be good. Other things that improve, that are really beneficial to auditory brain development, are things like singing to music. Even if you're singing Happy Birthday or Jingle Bells, or you don't have to be like a professional singer, sing nursery rhymes or sing pop songs off the radio, like whatever, because you're getting language and tonal information and both hemispheres of the brain communicating. Any kind of games that or activities that cross the midline are a good for auditory brain development or any brain development, because it lets both sides of the hemisphere, both sides of the brain communicate with each other. So generic things like improving the listening environment, playing singing games, like singing along to music, activities that cross the midline, like tossing a ball back and forth between hands, or drawing, like parallel drawing, like holding a marker or crayon in each hand and drawing like big circles or figure eights, like simultaneously with both hands. Playing Twister is really cool. There's like activities that you can do. Kids who drum or juggle, or do any kind of musical training, it's really, really good for auditory brain development. So there's all kinds of things you can do to encourage it. But if you think there's an issue, the best thing is to have a diagnosis and get some specific auditory training.
Sounds great. So what you described almost sounds like occupational therapy. The
Yeah.
crossing the
There's some
midline and
overlap. Yeah.
yes, yeah. Somebody is also asking if there are any training apps available for adults, or are they all geared towards children?
No, I say kids like screens, adults like their screens too. So, yeah, the apps can be used by adults. Like when I'm demonstrating them, like to kids, like I mean, I can play this game just as easily. Um, like it's literally, and a lot of them will learn with you. So as you progress, they progress and become more challenging because it's all about just training that skill. So yeah, the same apps can be used by any individual, right? It's just a
Yeah,
game. Games are fun, however old you are.
makes sense for children and for grown children as well.
Yes, for
So,
the big kids.
yes. Another question we have from Laura. Can APD be assessed if somebody has moderately severe hearing loss?
No, APD, like I said, normal audiogram is the first step. Like when I begin an APD assessment, I start with a hearing test and I do an audiogram because the test battery is normed on normal hearing. And a lot of the tests, some of the tests involve like how both ears work together. So if there's any asymmetry or there's any hearing loss, it makes it unscorable. Like there's so if you have a hearing loss, then you likely do have some auditory processing disorder or issues with auditory memory or things because of the poor acoustic signal getting in, unless you're wear your hearing aids 24/7, or your amplification. So anytime you have your amplification off, that means a poor acoustic signal. So yeah, just because of the inconsistent acoustic signal, there is definitely going to be some auditory brain issues, the auditory cortex, that brain development, because of you're not getting a pristine signal all the time because you have a hearing loss. But yeah, you don't diagnose that as a processing disorder. It's the hearing loss is the primary means of, yeah. So wearing your amplification, all your waking hours, make sure your child has their amplification on all their waking hours is, like, I preach that all the time. Like if you're choosing to amplify yourself or your child, then, go all in and wear it all your waking hours, because that's what's going to, and these general things like the singing and the games and the learning to play a musical instrument, like because you have a hearing loss doesn't mean you can't, play the trumpet or play the drums, and so, or sing in the choir or whatever. So all this will improve auditory brain development and making sure a good acoustic signal is getting in at all times.
Yes, we actually had a presentation, a webinar recently on April 29th for the World Noise Awareness Day
Yeah,
with two musicians who are very
yeah,
successful, and they sing and make music with pretty significant hearing loss for different reasons. So if you're interested in that, it is on our YouTube channel, so check it out.
awesome.
Uh,
Yeah, there was an individual I know who has he wears two cochlear implants with profound hearing loss, and he's in a band.
Yeah, yeah,
So yeah,
absolutely. So there is a tip, it's not a question, that
okay,
Elizabeth Avenue Clinic does the testing. I'm not sure which one they mean because there are two clinics in St. John's on Elizabeth
okay,
Avenue.
good to know. Good to know
Amplifon
if you can
Hearing
find that out for
and
certain. Yeah.
Red Door Hearing, that's now part of Hearing Life.
Okay.
So I guess it's one of them. If you don't mind typing in which one you mean, that would be
Yeah, because
great.
if you're a big kid, then you can go there for assessment then.
And another question I have is,
Okay.
does this type of training and treatment only provided is it only provided by audiologists, or do speech language pathologists also offer this type of service?
No, speech language pathologists can often be involved because kids with auditory processing disorder typically have speech and language delays. So they may need the services of an SLP, or an individual may need the services of an SLP. But they typically don't provide auditory training. That's from the audiologist. And it's not something the audiologist acts as a trainer. Like it's something that the family takes away. Like
Yes.
they are responsible for making sure their kid, or they themselves, the individual, puts in the time with the auditory training activities and apps.
Yes, it's just the know-how and the access to resources. That's what you would
Absolutely.
need a
Like
specialist for.
most people have a phone or a tablet, but even if they have no access to devices, there's auditory training that doesn't have to be digital. I always include some because, of course, kids love screens, and most kids will have access to a screen, and like to play something that's a game. And all the apps that I list are like light versions or free downloads from like the App Store or Google Play. I mean, certainly you can purchase apps, but I want to make it completely accessible. So there's no fee to download the apps, the light versions or whatever, and you can still get the same kind of training.
Yes, that sounds great. So we did get a clarification which center it is, and it is Amplifon Hearing Clinic in
Okay,
Lawton's building on the second floor. So it's located on 11 Elizabeth Avenue East. So
cool.
inquire there. I can give you
Definitely.
the phone number. It's 709-800-7343. So you can call there and ask if they offer this service.
Yeah,
All
definitely.
right. I think we have answered all the questions and just on time.
Ooh,
So
just in time.
this is Bernadine's contact information. If you have any specific questions about this session or about anything we discussed here today, please feel free to reach out. You're also welcome to reach out to us here at the Canadian Hard of Hearing Association, Newfoundland and Labrador. So our contact information can be found on our website. And thank you, everybody, for participating in this session. And I wish you all a happy May month, better speech and hearing months, and a great day. Thank you, Bernadine.
You're welcome. Thank you, everybody.
Okay, bye-bye.